I use the word flexion a lot. So what is flexion? Flexion is a type of joint movement. It's a movement in contrast to extension, which is in the sagittal plane of movement. We also have movements of the body in the frontal plane of movement and in the transverse plane, which is more rotation. Flexion in the anatomic position of the human body, where we stand with our feet straight, our arms to our side with our palms forward, is going to be generally thought of as moving forward. This is flexing my elbow. This is extending my elbow. This is flexing my shoulder. This is extending my shoulder. The knee, the middle joint of the lower extremity, is different than the elbow, which is the middle joint of the upper extremity. So knee flexion, in contrast to elbow flexion, is when the heel comes closer to the buttock. So they're moving backwards more so than all the other flexion movements of the different joints in the body. For the ankle, we use different terms like dorsiflexion and plantar flexion, but mostly when you think of flexion, you can think of going forward. Why this is important, I think why everyone needs to understand just the basic movements of our joints, is because I do believe these sustained forces and preponderance of forces in one direction over another do contribute to orthopedic health disorders, especially when it comes to the spine. I believe that over time, this imbalance has been increased because we've added not only lots of sitting for work, for example, but lots of sustained sitting. So more and more, I find people are sitting for long periods of time without getting up and walking around, perhaps not walking to work like they may have in the past, or walking to find lunch, etc. I think remote work may play a role in also more of the sustained sitting. And then of course, outside of work, there's more sedentary behaviors on the couch, in the car, not necessarily moving. So flexion of the spine is inherent to some degree in sitting, especially in the lower spine and in the hips. Slouched sitting is an important concept to understand because it increases the flexion in the spine, meaning we're curling it more, bending it more forward. So I think there's an increase in the sustained amount of flexion force we put through our spine, and to a smaller extent into our hips and perhaps our knees, although some people straighten their legs when they sit, and the shoulders, for example, aren't necessarily in prolonged flexion in the upper extremity. We can sit and do our typing, for example, with our shoulders in more of a neutral position. But the spine, I believe, takes the brunt of sitting, and especially slouch sitting, and especially sustained slouch sitting. Extension of our bodies, including extension of our spine, are when we move in the opposite direction. So when we walk, we can be in neutral to extended positions of our spine. Our hips can get extended, our knees can get extended. So walking is a very clear antidote to sitting in terms of just kind of general positioning. Although extension is also achieved by jogging more so, running more so, lying on your stomach. Those are actually adding more extension to the spine and to some other joints as well. So if you understand flexion versus extension, and abduction versus adduction, and internal versus external rotation, or left versus right rotation, if you understand the forces on the joints, you can better understand what's going on with the musculoskeletal system. Unlike other clinicians, I think these forces on these joints are really important for many, if not most, orthopedic disorders. People tend to think more about the muscles of the system, the ligaments and tendons of the system, and even the fascia. But I think primarily orthopedic disorders are joints. And part of the reason that joints have especially non-acute or non-traumatic problems is because of an imbalance of force through them. For a lot of lumbar complaints and neck complaints and mid-back complaints, not all, I can find by talking to the patient that there seems to be an imbalance of flexion versus extension or flexion versus rotation, and that addressing that in the person's daily lifestyle factors can be a key part of helping them get better. Now, lifestyle factors may not always be a role if there is an acute or traumatic event, of course, but for those who don't have a trauma, we need to be considering the amount of forces through a person's joints in their daily life, especially when it comes to flexion versus extension.